Typical heart symptoms, if people read the book, would be a substernal squeezing or pressure. And most often I hear with heart-related pain is that it's an elephant that's sitting on their chest. Because that pain is associated with an organ that needs oxygen, they start feeling other symptoms such as sweating. They get nauseous sometimes and severely short of breath. Now, not everybody always follows those.
How long does that chest pain last?
Chest pain can last anywhere from 15 to 20 seconds to hours at a time, and it depends on how bad the disease is the reason why the pain can be more prolonged than other times.
What is a heart attack like in the heart? What happens to the heart with a heart attack?
So the reason a heart attack occurs is that the heart, which is a pumping organ, needs oxygen at all times. And if the blood vessels that supply that muscle are blocked and the oxygen can't get to those muscles, you start to feel pain. And when heart muscle starts to infarct, or we call it die, that pain can be associated with cell death or just cell stunning. And so people can recover from a heart attack. It doesn't always mean that cells die.
And textbook classically, then it's a pressure crushing pain in the middle of the chest. What are some other symptoms that people need to be aware of that they could be having a heart attack? For instance, men and women, I've heard that symptoms are different for both. Are they?
Right, and women typically have more atypical symptoms for heart attacks. And again, those atypical symptoms may just be shortness of breath that's out of proportion to what they normally feel. And most often with heart attack, things are sudden, so that the artery, which was open 10 minutes ago, is now blocked. So any sudden change in symptoms, and we hear people get palpitations. They can again get lightheaded or dizzy. Extreme sweating or even nausea can be the more atypical symptoms that don't have to necessarily follow the chest pain.
Sometimes when people are having atypical chest pain or classic chest pain, do they wait too long? Do they not do anything about it? Or is it better to say, let me just wait and see what's going on?
Well, I think people, we hear chest pain stories all the time, and chest pain is common, and it doesn't always mean that your heart is involved in those symptoms. But if you do have something, and most of the patients I see that have heart attacks say, this was different this time. This is more intense. This is more severe. And patients that go to the hospital early with those symptoms, call 911, go via an ambulance, do better. We have a saying in interventional cardiology that time is muscle. So the faster I can see you and get your artery open, the better you're going to do.